I know that in the pro-life circles, they're always saying, oh my God, you're putting those 6-foot pictures of dismembered fetuses and, it's so awful looking and we don't have to do that. And my office manager, who's in her 30s now, she got pregnant when she was 15. And her parents wanted her to have an abortion, and she said, no, I'm not doing that. And the reason was when she was in 3rd grade, she saw a gap sign. And she said, what is that? And they said, well, that's an abortion. And she didn't know what an abortion was, but she knew that she was never going to have a part of that. So those pictures, as uncomfortable as they are, do matter, and they do have an impact. So this is an example of a screenshot. And so, that left-leaning website, called the Daily Beast, they actually had a pro-choice man write an article saying after he saw that video, he didn't really know anymore. He said, I think that when men say they're pro-choice, it's like they're stepping back from the argument. So they're not put in the middle so that they don't really have to take a stand. Oh, it's whatever you want, dear. But after he saw that, he saw those pictures, he had a real mind change. And he said he didn't know if he could say he was totally pro-choice. And then on the videos, you hear them talking about, wow, sometimes we get intact fetuses. And so you're saying, well, how the hell would that ever happen? Well, you have to remember that 10% of all abortions done in this country are done in the 2nd trimester. So in order to get a dead fetus out, that's why you had to have the DNX procedures. Because if you did the partial birth way, where you pull them out by their legs and then stick a trocar in the back of their head and suck their brains out so you can get it through the cervix, you kind of ruin the thing. You have to do it that way. Otherwise, you run the risk that the kid will come out crying. And then what do you do? Well, if you're in an abortion clinic, you just kill them. But so what happens is 2nd trimester abortions have to be done by putting laminaria in the woman's cervix to soften it and get it dilated enough so it can be stretched open enough to get the fetus out. And sometimes after those laminaria go in, the woman delivers prematurely. And then the whole baby comes out. And so I guess those are very prized because all of the specimen is intact and you can dissect out what you want. The Center for Medical Progress is facing court challenges. They've prevailed in the first set of them. What's interesting is there's talk in pro-life circles. Does everybody know who Robbie George is here? Robbie George is a Catholic professor at Princeton, and he's written a number of books and is very well known in intellectual Catholic circles and has an impact enough to have a magazine story on him from the New York Times. But he's criticized them. He's criticized the center because they were deceptive. When they went into the abortion clinics, they didn't say, I'm an undercover investigator and I'm really pro-life and I want to catch you. But and he said that morally that was wrong. But that's like saying, the FBI is immoral, when they go on the internet and act like, they're part of the ISIS organization recruiting people. Well, you gotta. And is it, if the Nazis came to your door and said, are you hiding any Jews? Are you going to say, yeah, they're in the attic because you want to tell the truth? So I think that this is a case where deception is moral because there would be no other way that this would come out. Certainly you wouldn't be getting those pictures and those comments. The one thing that I haven't seen is anybody bringing up the subject of who's getting these pieces? Who's getting these babies that have been cut up and used as like things. Who are these researchers? Most research money in this country comes from our government. So they're at big universities getting government money, which means it's your money because it's tax dollar money. And there wouldn't be a market for these baby parts if there weren't some researchers that really wanted them, that really wanted the liver. I remember I was at a breast meeting in Florida in 1999, and I was talking to a pathologist that worked in a New York City hospital. I was talking about the abortion breast cancer link, and he told me that when there were abortions, they were, say, 20 weeks or something, and the kid would come down to the pathology lab, it wouldn't weigh the right amount. And it was because before it got to the lab, the liver was taken. You didn't know who was taking it, but they were being taken. So this is something that's been going on a long time. I think we do have to, it's about as moral to say that, well, these fetuses, we didn't say, kill your baby, I want the parts. So like they did in Molech's time, but these people are saying they want these organs. They have to know that they're coming from aborted fetuses. So what's the difference? I mean, it's about as moral doing that as it is to say, well, we're killing the Jews anyway. They would make good lampshades. Why should their bodies go to waste? So I'd like to see some commentary on that. I'd like to see them get that. So our federal tax, I don't want my tax dollars going that way. So I think investigative journalism and freedom of the press is really what's needed to continue to bring this to light. When I saw that list of pro-life doctors, because I knew before I came down here that there was like 1,000, identifiable pro-life doctors. I'm in New Jersey, and it's very lonely in New Jersey. And I was thinking, wow, what could we do if I was in a community like this, where there actually were doctors willing to say they were pro-life? All right, so now I'm going to talk about breast cancer. And have you noticed that there's more and more young women with breast cancer? When I was in medical school in 1975, it was 1 out of 12. Grandma got breast cancer. There was very little premenopausal breast cancer. But since 1996 to 2009, this study came out and got some play in the popular press in 2013. That showed the incidence of metastatic breast cancer in women under 40 had gone up 2% per year for all those years. It was huge. I mean, metastatic breast cancer, advanced breast cancer. The woman who wrote this article got breast cancer when she was 27. So since 1976, if you look at the SEER data that you can get off the cancer.gov and National Cancer Institute website, there's a 400% increased risk of in situ breast cancer of women under 50 since 1976. So there's a lot of it. Now, the cancer societies like the American Cancer Society might say, oh no, really, it just seems like there's more. Women are more forthcoming now. They'll talk about it. In the old days, they wouldn't talk about it. Really, if you look at the numbers, it's really the same. Well, it's not, because what they're doing is they're talking about invasive breast cancers. And those have only gone up about 30 to 40%. But they're not talking about the cancers that are in situ, non-invasive, that will become invasive cancers if they stay there long enough and they're not treated. So anytime you give a lecture to doctors, you have to have objectives. So these are the objectives. I wanted you to understand all of the risks, something about the susceptibility window, reproductive risks, And the physiology, what is there about the biology of the breast as it matures that will cause an association of breast cancer and abortion? Now, if you think about breast cancer risk, you know how like you get one study showing if you eat French fries when you're 3 years old, you have more breast cancer and things like that, and they put it on TV and people wonder. And it's very confusing. And my husband doesn't listen to any of it because he says, they're always changing their minds. I'm just doing what I want to do. But there is a rhyme or reason to breast cancer risks. So if you think about risks in category, only about 10% of them are due to things that are caused by damage to the DNA in the breast cell. So you have mutated DNA. If it's mutated bad enough, you're going to get a cancer cell. So about 8% of them are the BRCA genes, like Angelina Jolie. Those kids that have Hodgkin's lymphoma and get radiated to their chest when they're 15, if they're not shielded and their breast tissue gets radiated, they have an increased risk of breast cancer because they've gotten mutations in their breast cells. Maybe it was a chemical that caused it. So let's get rid of that 10%. That means 90% of it is due to how much estrogen do you get exposed to in your lifetime, and how soon do you fully mature your breast tissue through a full-term pregnancy or one that lasts at least 32 weeks. So that's 90% of all breast cancer risks. Cumulative lifetime exposure to estrogen, because estrogen is a mitogen, it makes your breast cells grow, as well as a genotoxin, and a lot of people don't know that. And then when you differentiate your breast cells, like you're born with just a little few rudimentary lobules under your nipples when you're born, men and women have the same amount. And that's why when you have the transgendered women or the transgendered men that become women, I've had them in my practice, and you can't tell the difference between their breasts and a regular breast. It's because they're sensitive to estrogen and progesterone, and you can make them grow. So just remember those two things. This is repetitive so that you learn it. More estrogen you're exposed to, the higher your risk. And the sooner you differentiate your breast tissue to type 4 lobules that contain milk, the lower your risk. So what does it mean when you say the estrogen acts as a mitogen? It causes growth, proliferation. Your breast grows by having one breast cell that divides into 2. And it also acts as a cancer promoter because cancers can have estrogen and progesterone receptors. So you take estrogen and your cancer grows faster. So for the OBGYNs in this room, I show this slide, and sometimes the OBGYNs say, oh, do that again. Because, they're concentrated on your uterus. The breasts they do when they do their pap and pelvic. But, they're concentrated on that. So how does your breast change? Well, most people think your breasts are just hanging out, looking good, not doing too much. But the entire menstrual cycle, they're changing. So what's happening in that upper part, in the first half of your period, in the follicular phase? Well, your ovaries are only producing estrogen. So what's happening in your uterus? It's proliferating. That lining is getting thicker. But what's happening in your breast tissue, your lobules? Nothing much. There's no mitosis. It's just, it's not doing nothing. That's why estrogen, when the pill first came out, they were getting a lot of uterine cancer. So the OBGYNs know that, and they say, oh, that's not good. I know. We'll put some progestin in there, some progesterone. And then they'll get the differentiation. they're protected because they're differentiated. But what happens when you put estrogen and progesterone out of your ovary in the second half when you've already released the egg? All of a sudden, you get all of this growth. Your estrogen goes up with progesterone, and you get epithelial mitoses. Your ducts, cells lining the milk ducts and the lobules that make the milk are growing. And that's why your breasts hurt. That's why they get sore and tender right before your period. And then your period ends when those levels of progesterone and estrogen crash down and, the progesterone goes away. And then your breasts get back to normal. So that's why they feel better a couple of days after your period starts. How many people knew that in 2005, the World Health Organization's International Agency on Research of Cancer classified estrogen and progesterone combination drugs as group 1 carcinogens? It came out in Lancet Oncology. So there are 5 groups of carcinogens. 5 is maybe there's a case report. 3, there's some experimental evidence. By the time you get to 1, there's no doubt it's a carcinogen. Well, that came out in Lancet, and there was no reporting on it. And what it said was it was carcinogenic for breast, cervical, and liver cancer, but protective of endometrial and ovarian cancer. Well, you already know why it was protective of endometrial cancer, because it differentiated your lining. And the fewer times you ovulate in your life, the lower your risk of ovarian cancer. So it's protective of those cancers. So your cancer rates for those 2 cancers go down with the pill. But out of 100 women with cancer, 36 have breast cancer, 6 have endometrial, and 3 have ovarian. So it's not like it's a good trade-off. So what do we mean about that proliferation? Well, if you keep getting stimulated, you get stimulated in your menstrual cycle. But if you get overstimulated, like you're taking the pill, you can get ductal hyperplasia or even cancer formation, that neoplasia. So this is you can't see it. A normal duct will have 1 cell lining, lining the duct. Hyperplasia, more than 1. But with that, all those divisions, all those replications of DNA so they can divide into 2 cells, some of them start looking funny. And those are atypical cells. So if you progress to that point of atypical ductal hyperplasia, you've got about a 400% increased risk of getting breast cancer. And when one of those cells mutates and starts filling up the milk duct, that's ductal carcinoma in situ. That's what's increased 400% over the last 30, 40 years. If you look at when you go to the doctor, you have a lump, you get a biopsy, and they say, good news, it's not cancer. Well, you have to know more than is it not cancer? Because there are things that can show that you're at increased risk that's good to know about. So if you had that florid ductal hyperplasia or papillomas, you might have double the breast cancer risk. And if you have any atypical cells, abnormal appearing cells that are not cancer cells, that's a 4 to 5 times risk. So let's go through the menstrual cycle. You're ovulating, you have that estrogen peak, it makes you release an egg, you ovulate, and then it stays high until right before your period. So estrogens in the presence of progesterone stimulate the cells to proliferate, undergo mitosis. And when you make a mistake, when you double that DNA, especially if you're doing it fast, because it's like copying a book or copying a sentence. If you copy it real fast, like they do in type 1 lobules, you'll make a mistake, a mutation. And if you do things like leave out the word the, you'll still get the sense of the sentence. It won't be such a big deal. But if you leave out the word no, the whole sentence will change its meaning. And that's a critical mutation that can result in a cancer cell. So here's our cell doubling from 1 to 2 and then 2 to 4. And then you make a mutation. Okay. But then that mutated cell, it keeps growing too. So it's proliferating. And then you get all of these mutated cells mutating more. And if you get enough of them, you end up with a cancer cell. And that's unregulated growth. So cancer cells have unregulated growth. So anytime you stimulate breast tissue to grow, you can make a mutation, a cancer cell. And so proliferation of the breast is not such a great thing. Although teenagers love it. That's why they love the pill, because one of the things the pill does is, besides getting rid of their acne, it also increases the size of their breasts. Okay, now how does estrogen act as a carcinogen? Because estrogen is what makes women women. It allows us to have babies. We wouldn't be women without it. So it's very hard to get over the concept that estrogen might not be a good thing, might be a double-edged sword. So in 1988, there was this lecture saying estrogens is a cause of human cancer. And it was an illustrious thing that showed that you had more germ cell tumors. And it showed that estrogen-induced cancer caused it. And actually in 2001, I don't know how many of you heard about this. This actually made it to a Philadelphia paper, where the National Toxicology Program Advisory Committee put estrogen on its list of carcinogens the same year it put wood dust and creosote. And when the AP reporter went to one of the members and said, "Michelle, why'd you do that? You're scaring women. How could that be?" And she said, "We put it on the list because doctors only discuss the benefits. When we put it on this list, maybe they'll force it. It'll be forced on the table of discussion." 2 years later, in 2003, in the Journal of the National Cancer Institute, they had an article entitled "Estrogen and DNA Damage." This quote, "The silent source of breast cancer?" ? And David Longfellow, who is the head of the chemical and physical carcinogenesis branch at the National Cancer Institute, said, "It's been an uphill battle to convince the mainstream," meaning doctors, he's not trying to get to the public, just doctors, "that estrogen can initiate cancer by damaging DNA." So, how does that work? Well, there was this researcher, Eleanor Rogan from Nebraska, and she looked at the metabolites of estrogen. So estrogen is made and then it's processed by our body into different other chemicals. And what she found was, if estrogen, has, I think, 19 carbons, if it's metabolized at the second carbon, that's a good thing because it gives you weak estrogen. But if it's metabolized at the fourth carbon, you end up with a chemical called estrogen, catechol estrogen quinone. And what that does is the rungs of the ladder in the DNA are made of purines and the other things. And it actually pulls the purine bases out of DNA chains. And she actually found it was clinically significant because she measured the levels of that metabolite in women with cancer and without breast cancer and found that it was much higher in women with cancer. So it made a difference. Finally, 2006, Nancy Davidson, who was at Hopkins at the time, put out this article in the New England Journal and said, estrogen causes breast cancer. And she got a lot of caca for it. There was an article, a letter to the editor in the subsequent editions of the journal saying, a few years ago you said it wasn't a carcinogen. How could you do that? Of course it's fine. And she said, "Nope, looked at the data, changed my mind. It does cause breast cancer." All right, so estrogen, progesterone together stimulates the breast, and it can also initiate breast cancers. So what about this differentiation? What's happening in our breasts? Well, you want to get the type 4 lobules that contain some milk. You want to get them mature. And how do you do that? You do it by getting pregnant. Those are pictures of what the type 1, type 2, type 3 lobules look like. And it's the biology of how you get to that type 3 lobule after a full-term pregnancy that results in the protective effect of a full-term pregnancy. So since the Middle Ages, they noticed nuns were the only people getting breast cancer, because everybody else was like Romeo and Juliet, having kids when they were teenagers. But nuns were largely childless, and they were the ones with breast cancer. So that's been noticed for a long time. So how does that work? Well, what happens during pregnancy? The late Robin Williams said that as soon as his wife would get pregnant, the breast fairy would visit. And it would be like this. And the reason for that is you double your breast volume in the first half of pregnancy. So even though the OBGYNs will say you're pregnant for 9 months, I don't know how they figured out 40 weeks, a full-term pregnancy, translated into 9 months. So they're lying to you from the beginning. I felt that way when I was pregnant. Anyway, so up to 20 weeks, you're making more breast tissue. But it's only after 32 weeks that you get enough of the matured ones that you get the differentiation that protects you. So this is just how your breast is made. It's made of about 15 to 25 lobes, and the lobes are made of lobules, and the lobules are made of individual cells. This is a schematic drawing of how type 1 are very rudimentary and only have about 11 little things sticking out of them, the ductules that become the glands that make the milk. Type 2 that you get after you go through puberty, about 25% of your breast tissue is type 2. Type 3 has 80, so it's like the most mature. Type 4 have the milk in them. Now, it's not that they look different that's important. It's how they act physiologically that's important. So type 1 has many more estrogen and progesterone receptors in it. So they'll go crazy growing when you throw a pill at them. With the type 3, you can barely find any. And there are other qualities about them too. How rapidly do they double their DNA? How rapidly do they go through mitosis? Because remember, I said the faster you do it, the more likely you are to make the mistakes.